These stories about our faculty and students are certainly great testaments to the impact of the NDSU community. And Dr. Brashani, how proud does this make you as the leader of the institution, and to just reflect on the impact our students and faculty are having?
Well, it's not just a matter of pride. It's being thankful. We have some of the leading people, not just in Fargo, not just in North Dakota, in the nation here at North Dakota State University, changing the lives and the futures of countless people. But that's what research universities do. That's what land-grant research universities do, better than anybody else in the nation, and that's what I'm proud of. What we do here matters.
Yeah, it's a great story, and we do have one of our students that we're very proud of here with us today. And I'd like to introduce Brenda Vincent, who's with us. And Brenda is a Ph.D. student in the statistics program in the College of Science and Mathematics. Brenda has an undergraduate in mathematics and a master's in biostatistics. So Brenda, thank you so much for being here today.
Thanks for having me. It's great to be here.
So let's start by having you explain the research that you have worked on with the North Dakota Department of Health.
Absolutely. So when everything kind of got started in the state, things sort of got out of hand very quickly, and there's a lot of data that is being brought into the state. And I have previously worked with Dr. Carson, who we've heard from today, and Dr. Carson was working with the Department of Health, and the conversation really started that we could really use some more support to actually analyze this data. So I got brought in, myself and my advisor, Dr. Choi from the Department of Statistics, and we were originally working with the Department of Health to try to build a model to predict the number of cases, hospitalizations, and deaths that are going to occur in the state in the next upcoming 30 days. So to do this, what we were doing is, as we were getting this information of this case information and these hospitalizations and this death information, we were trying to build a model that would kind of see what that trajectory looks like and see if we can predict out what's going to happen in the next 30 days. Now, the key with this is that things change, and they change for lots of reasons. And so this is something that was a very fluid process. And as we got more information, we updated our model. And the whole goal of this was just really to provide support to the Department of Health so that they can start to look at where should they be focusing resources and that sort of thing. So that was where things started with the Department of Health.
So you talk of change, a real life, real-time situation. As the pandemic has continued to evolve, how has your own research and projects evolved as well?
Yeah, so as that original model building process, it's still ongoing, but we've started to shift our attention towards looking at outcomes related to COVID-19. So. Well, one of the projects I was actually involved in, Dr. Carson mentioned, which is looking at the wastewater and trying to use that wastewater information to do some population level surveillance. So my whole goal with using that data is trying to predict, how can we look at that wastewater data, the amount of the SARS-CoV-2 virus in the water, and how can we use that to predict the overall number of cases in an area, right? Because right now we're doing individual testing, and that's not necessarily a sustainable option for the long term. So that's one project. Another project I'm involved in is looking at women who were pregnant with COVID-19 and looking at how the outcomes of their infants might be different than if they had not had COVID-19. So to do that, we looked at birth record data for women who were born or who gave birth in the state of North Dakota in 2020. And we were looking at just what happened to their infants and that if they had COVID-19. We're looking at things like NICU stays, having low birth weight, that sort of thing. So that's still in process, and so we're still looking to understand that. Sure. And the final project that we're currently working on is looking at how college students experience quarantine and how they may feel burdened by it. So what I mean by that is, right, so this is more so last semester now that we only have 3 cases, but when a person comes in close contact with someone who has COVID-19, they're supposed to quarantine. Well, quarantining as a college student comes with its challenges, and for anybody, but we wanted to understand what experiences college students had during that, and if there's anything we can do to help alleviate that burden. So we looked at things like healthy behaviors, eating good foods, physical activity, stress, concerns about money, concerns about school, that sort of thing. So that's kind of where things are right now.
Well, it's really been quite a year for you, and certainly an experience that probably was unanticipated, right? As you pursue your education and research work. I mean, not everybody gets to work in a pandemic and learn things along the way.
Yeah.
Just as you reflect back and think about what have you learned the most, or how has this really changed you and your own passions?
Yeah, I mean, you're absolutely right. I never would have thought that I would have had the opportunity to work with such live data in the middle of a pandemic, but here we are. I think that, I've always been very passionate about what is that intersection between how can we use data to help improve health. And the fact that we have an opportunity to look at that while, events are rapidly unfolding has been just instrumental to, I've had, it's been so rewarding for me. And, I've never experienced working with data that is changing so rapidly. So that has been something that, has been a huge opportunity for my professional growth of how do we deal with a data set that changes, and how do you use your statistical method that may no longer be valid as soon as you get the new data. So thinking about how to use information as it comes in, and just thinking bigger picture, like how can statisticians like myself, or data, people who use data, how can they help improve the lives of people? And that's something that I've, will always take away from my experience working with the Department of Health, and I hope to take with me into my future.
Those are great stories and great examples of real-time research and a real-time environment that's unfolding. So, Dr. Brashani, I want to come back to you. You've heard these stories, certainly in a focused area. NDSU is very broad, diverse, and has expertise and the ability to impact our community and regions, in so many different areas. But what do you take away from these stories and from the pandemic and the work of our faculty and students?
Well, I think the most exciting revelation that people are starting to get, and what you were just talking about illustrates, people portray higher education as being this monolithic, slow beast, the ship in the night that takes years and years to turn. And in hours and days, we turned and started solving a state, national, and worldwide health crisis. That's what research universities can do. We're extremely dynamic and nimble when we need to be, and responsive to the people that we serve. And it's going to be hard for people to forget that for a while.
Wouldn't be possible without your leadership. So thank you for all you do for NDSU and leading our students and faculty and programs. So honored to have you with us today.
And thank you all. And thank you for the people that make it happen.
Brenda, thank you very much for being with us today. Really appreciate your stories. So,
it was my pleasure. Thank you.
I hope the stories you've seen and heard during this program provided insight into the ways our students, faculty, and staff have been working to track, understand, and solve the COVID-19 problem.